Derya Unutmaz is an immunologist at the Jackson Laboratory, and he joins us now from Connecticut with more. Great to speak to you once again. Help us understand, how concerned should we be with the rate of infection of COVID-19 here in Turkey?
I think we should be very concerned. Basically, we have to look at the data from other countries and what kind of trajectory Turkey is following right now. Unfortunately, I don't think we have reached the peak like some other countries like Italy, which looks like they've sort of plateaued and the number of infections are declining. Fortunately, New York City just looks like they've reached the plateau. But I think in Turkey, we're still at the rise period, and the number of cases will continue to rise for the next couple of weeks, I think.
And Turkey's measures to prevent the outbreak went in early. How significant was that?
I think, there were some significant measures taken, like closing the borders and other measures. But unfortunately, the measures requires the whole country to really abide with them, because if you don't isolate people, or if people themselves voluntarily isolate themselves, wear masks, I think it's going to be very difficult for government to control this. So it is really essential that the whole society really understands how serious this problem is, and really try to stay home unless they really have to go out.
And going back to the confirmed cases, Turkey confirmed nearly 4,000 cases in a single day. How does that compare to other countries? Why is it so high?
I think so the cases really reflect the number of tests that are being done. So they're not necessarily the real true number of infected cases. Turkey has been increasing the number of tests that they are doing. I think it's about 20,000 a day now, and they have to continue to increase. Probably double by next week. And you can see that very clearly in the U.S. As they increase the test numbers right now to about 150,000 a day. The number of cases are also increasing. So there's a significant portion of people who are infected, probably around 80%, who either don't show symptoms or very mild. So the true cases are probably much higher, and then there's a sort of a lag as people get infected. They don't immediately go to the hospital, only if the symptoms get worse. And so what you're seeing right now are the infections that happened a couple of weeks back. And as I said, basically, it's really the reflection of the number of tests that have increased right now.
And the Turkish health minister said that 2 Turkish professors had managed to isolate the virus. Help us understand what that means and how significant it is.
My understanding is that you have to grow the virus in the lab environment, and we've been doing that here. You need a special laboratory called BSL-3 laboratory. The virus was isolated early January by the Chinese scientists, and this was given to other countries. So I think it's significant from Turkey's perspective that such work can be done there in a BSL-3 in a very high level biohazard lab. And so basically you grow the virus in a particular cell type in the laboratory. And the reason why this is important is that you want to be able to test various drugs, various methods to see if you can stop the virus. And also there's a potential way to create a vaccine from the virus that you produce in the laboratory environment. Of course, that virus will need to be killed to be tested in humans, although that's probably months away. So I think in terms of a capability to do that in Turkey, that is significant.
Okay, Professor Derya Unutmaz, a pleasure once again to speak to you here on TRT World. Thank you.